Hello everyone, welcome to QAxon. Pancreas is an organ in the gastrointestinal tract. It has exocrine as well as endocrine function. In this video, we are going to be dealing with the endocrine functions of the pancreas. The hormones secreted by endocrine pancreas are insulin, glucagon, amylin, somatostatin, and pancreatic polypeptide. The hormones are secreted by part of the pancreas called islets of Langerhans. It has four types of cells. Alpha cells secrete glucagon, beta cells secrete insulin and amylin, the delta cells secrete the hormone called somatostatin, and the PP cells they secrete pancreatic polypeptide. First, we are going to see about glucagon. It is secreted from the alpha cells of the islets of Langerhans of the pancreas. It acts on the liver and adipose tissue and acts through the second messenger system, cyclic AMP. It is regulated by the blood glucose concentration. Actions of glucagon include its role in glucose metabolism. It increases blood glucose concentration by increasing glycogenolysis, that is breakdown of glycogen to glucose, and it increases gluconeogenesis, that is formation of new glucose. In lipid metabolism, it increases blood fatty acid and keto acid concentration. It also increases lipolysis. Glucagon increases urea production. Regulation of glucagon secretion is mainly by the blood glucose level. Factors that increase glucagon secretion include decrease in blood glucose, increase in amino acids, especially arginine, cholecystokinin. This hormone alerts the alpha cells whenever there is a protein meal. Norepinephrine and epinephrine increase its secretion, and acetylcholine. Factors that decrease glucagon secretion are increase in blood glucose level, hormones like insulin and somatostatin, and presence of fatty acids and keto acids. Moving on to insulin. It is secreted by the beta cells of the islets of Langerhans of pancreas. It contains alpha chain and beta chain. These chains are linked by disulfide bridges. Insulin is secreted as proinsulin as a single chain peptide. In the storage granules, the C peptide is removed and insulin is produced. So we have first the pre-proinsulin, which is converted to proinsulin. Then it undergoes peptic cleavage and results in the formation of insulin. You can see here that we have A chain and B chain, that is alpha chain and beta chain, and the cleavage happens at this place. The C peptide is cleaved and this results in the formation of insulin. Now I am going to explain how insulin is secreted by the beta cells. The beta cells have receptors for glucose called glucose transporters. So glucose enters through these receptors depending on their level in the plasma. So when glucose enters inside the cell, it is converted to glucose 6-phosphate in the presence of the enzyme glucokinase. This is said to be a rate limiting step. This glucose 6-phosphate undergoes oxidation and results in increase in the formation of ATP molecules. These ATP molecules will block the potassium channel. The blockage of this channel results in depolarization. So once depolarization happens, calcium channel opens and this is going to cause the fusion of the insulin molecules and secretion of insulin through a process of exocytosis. This picture shows the mechanism of action of insulin. Insulin binds to the alpha subunit of its receptor, which causes autophosphorylation of the beta subunit. This in turn induces tyrosine kinase activity. The receptor tyrosine kinase activity begins a cascade of cell phosphorylation that either increase or decrease the activity of the enzymes. This also includes the activity of insulin receptor substrates. They mediate the effects on glucose, protein, or fat metabolism. For example, the glucose transporters, they are moved to the cell membrane to assist in glucose entry into the cell. Factors that increase insulin secretion are increased blood glucose, blood-free fatty acids, and blood amino acid levels. Gastrointestinal hormones like gastrin, cholecystokinin, secretin, gastric inhibitory peptide. Hormones like glucagon, growth hormone, and cortisol. Parasympathetic stimulation, that is acetylcholine. Then beta adrenergic stimulation. Insulin resistance obesity will cause increase in insulin secretion. Sulfonylurea drugs, examples being glyburide, tolbutamide, also cause increase in insulin secretion. Factors that decrease insulin secretion are decreased blood glucose level, fasting, hormone like somatostatin, alpha adrenergic activity, and hormone like leptin.